Here we are again at Dr. Smith's office in Sedona, and we were with three of Dr. Smith's patients who were referred to him for sleep problem issues, sleep apnea. So I'd like you to first meet Jeff Dolan. Jeff, good morning. Please tell us about your experiences with Dr. Smith.
Well, it's interesting. I had some heart work done in Phoenix, and I was out for 5 hours, and of course when I was out, I snored a lot, and the medical people down there, in a polite way, told me that I should have a sleep study test because it was obvious to them that I had a sleep apnea issue, and I put it off, and eventually I went to Cottonwood and had a test done, and I woke up 18 times during the test, and I've been having a horrible time sleeping, and I was never, in the morning I just didn't want to get out of bed. I felt terrible, and just wasn't normal, you know, and so I talked to a physician about it, and went and got a CPAP machine and tried it and absolutely hated it. I just could not tolerate it, and I don't like sleeping on my back anyway, and I kind of felt that was the only position I could sleep in, and so I was complaining to my dentist, and I had seen, you know, an ad, you know, that's a very sort of ambiguous ad about an alternative, and so I mentioned it to my dentist, and he gave me Dr. Smith's phone number, so I made an appointment, and boy, I'm sure glad I did. I can't imagine life without that, you know, device now. I get up every morning, I feel great, I feel rested, I'm no longer waking up all night long, and it's terrific, and you know, his care has been great, you know, the repeat visits, you know, to make sure everything's working fine, and I couldn't be happier.
This appliance that you put in your mouth, can you describe it and tell us a little bit about it?
Well, you know, when people ask me, I tell them it's like having a football mouth guard in, you know. You know, you have your lower teeth covered and your upper teeth covered, and then there's a little bar that kind of, you know, keeps your lower jaw forward, and gradually, you know, every week I turn the screw and get it a little more forward, because the whole issue is really, so, you know, your throat closing down. You know, and a lot of people, you know, the older you get, the more lax the muscles get, and so I was literally like shutting off my air supply in the middle of the night. I had no idea, but that's what I was doing. And snoring is merely just a small symptom of the real issue. And so this device keeps my lower jaw forward, and it's great.
Interesting. And how has this improved the quality of your life?
Oh, it's terrific. You know, I mean, I just was getting up in the morning and like not wanting to get out of bed, and that's a terrible way to start the day. You know, with absolutely no energy at all, and that's all. You know, I'm back to being me again, and you know, I go to bed at a normal hour and I get up at a normal hour, and it's terrific.
Lennis, why don't you tell us about your experience with Dr. Smith and what brought you here, and share with everybody your experiences.
Okay. Well, I went into my doctor, oh gosh, about 1.5 years ago, and I don't remember what I actually went in for right now, but I remember telling him before I left that I was pretty tired all the time. And he, you know, basically I was in good health, and he just looked at me and he said, "Lennis, do you snore?" And I said, "I don't know." And I said, "You'd have to ask my husband." And he says, "Well, go home and ask him if you snore and get back to me." So I went home and I asked my husband if I snored, and he says, "Oh yeah," and I kind of was embarrassed, you know, and he says, "Sometimes you even kind of stop breathing." And I thought, oh no, you know. So I went back and told my doctor, and he says, "I kind of thought so." He says, "You need to have a sleep test done." So I went to Verde Valley Medical Center, to their sleep center, and had a sleep test done. And sure enough, I had mild to moderate sleep apnea. Well, he said, after all the results came through and so forth, they said I would have to get a CPAP machine. And I went into AllMed and looked at these horrible things up on the wall, and I said, "Is that what I have to have?" And she said, the woman said, "Yes, it is." And I thought, oh, I don't know if I can do this or not. But I knew the results if you don't take care of sleep apnea, so I thought, I've got to do this. So they fit me with the smallest sleep apnea, or the smallest CPAP machine, excuse me. And I went home and I tried it, and I thought, is this how I have to live the rest of my life? It was very uncomfortable for me. It kept my husband awake. and you have to clean all these little parts every week. Put it bluntly, I was miserable, but I thought I've just got to do this. So then I was reading through some of the literature that I had gotten with the CPAP machine, and it said there are alternatives to CPAP machines. And I thought, it was just in small print, and I thought, alternative? I wonder what that could be. So I went back to the woman that gave me the CPAP, or fit me with a CPAP machine, and I said, what do they mean by there are alternatives to CPAP machines? And she said, well, there is a mouth device you can wear if you don't have severe sleep apnea. And I said, well, what is that? And she said, well, and then she proceeded to tell me about Dr. Smith. And I mean, I got very excited. And she said, it's sort of like a little appliance that fits in the mouth. It just weighs a couple ounces. And when she described it, I was excited. Anything was better than the CPAP machine. So I immediately made an appointment with Dr. Smith, and it was all positive from there on. I was just so happy. He was so good very thorough about everything, and fit me with the appliance. I've had no problems with it at all. I sleep like a baby. I even wear it over braces on my lower teeth. They were able to file it a little bit, and I even wear it over the braces. So I had been very, very happy, and I will never go back to a CPAP machine. I mean, to me, this is an answer to prayer. It's
so
great.
You sleep all night through, and
Oh
you're
yes,
rested,
oh yes. I am. This is really going to sound strange, but if I don't have it on, there was one occasion where I was so exhausted, I just almost fell into bed. We got home late, and I didn't put it on, and it felt like something was missing. I know that sounds strange, but I'm so comfortable with it, and I was so just plain miserable with the CPAP machine, and it was always slipping to one side, and the air was seeping through it. My husband would say, "What's that?" And I said, "Oh, wait a minute, I've got to adjust it." And it was just very difficult.
And now you're a happier person.
Oh, I'm a happy camper.
Now, Mary Ann, I understand you had sleep issues that brought you here to Dr. Smith. Could you share with everybody some of your life experiences?
I sure did. I had sleep issues that started probably 4 years ago. And I was falling to sleep when I was driving. I was not feeling rested. And I thought, something's wrong. But I didn't know what was wrong. I read an article in the newspaper, and it talked about sleep issues. So I self-diagnosed. I thought, I think that's what I've got. And I went to see a sleep doctor about that. And they, of course, tested me. And yes, I was waking up about 20 times an hour. And they put me on a CPAP machine, but it was just the nasal sleep PAP machine. And I had to keep my mouth shut and sleep on my back. And it worked for a while, and I did feel better. But then I started having sinus drainage, and it got so bad that my nose ran constantly. And I thought, I can't do this. I talked to my doctor about it that had prescribed the machine, and he said, oh, you have allergies. Take a Benadryl, do this, do that. And nothing was working. So I talked to my dentist about it because, again, I went back to the newspaper and I read about this dental device, and I thought, well, maybe that would help. So I talked to my dentist, and he said, yes, there's a doctor in Sedona, Dr. Smith, and he is working with patients with a dental device. I thought, hallelujah. I made an appointment right away. I came over, and Dr. Smith did an excellent exam. And since I'm from Prescott, he did the exam, he did all the fitting, he did everything in one day so that I only had to make one trip over here. And then I came back and got my device, and as most people know, you have to adjust it so that eventually your jaw is coming out and you're opening your airway. And I had absolutely no pain. It just went so smoothly. I was very happy with the results. And I feel better. I feel rested when I get up in the morning. I go to sleep, and we'll have to check with my husband to see if I'm still snoring, but he hasn't complained as much. So I'm very happy with the results that I've received.
Wow, so you sleep all night through?
Yes.
Wow, that's amazing.
Thank you for watching this video. Please visit our website, sleepbetterdoc.com. We look forward to seeing you. Please call for an appointment to schedule. Thank you.